Barrett's esophagus is a condition in which the lining of the esophagus, the muscular tube that carries food from the mouth to the stomach, undergoes abnormal changes. It is often associated with long-term gastroesophageal reflux disease, GERD, a condition where stomach acid frequently flows back into the esophagus, irritating its lining. This chronic exposure to stomach acid can lead to the replacement of the normal squamous epithelium, flat cells, with columnar epithelium, taller cells, a process called intestinal metaplasia. This altered tissue resembles the lining of the intestines and increases the risk of developing esophageal adenocarcinoma, a type of cancer. Causes and risk factors. Barrett's esophagus typically develops in people with chronic GERD, though not everyone with GERD will develop this condition. Key risk factors include chronic acid reflux. Prolonged exposure to stomach acid due to GERD is the primary cause. The acid damages the esophageal lining, triggering cellular changes. Age, it is more common in adults over 50. Gender, men are more likely to develop Barrett's esophagus than women. Ethnicity, Caucasians are at a higher risk compared to other ethnic groups. Obesity, excess abdominal fat increases pressure on the stomach, worsening reflux. Smoking, tobacco use is linked to a higher risk of Barrett's esophagus. Family history, a genetic predisposition may also play a role. Symptoms. Barrett's esophagus itself does not cause specific symptoms. Most individuals discover the condition during tests for GERD or other related disorders. Common symptoms are typically associated with GERD and include heartburn, a burning sensation in the chest or throat. Regurgitation, sour-tasting acid or food coming back into the mouth. Difficulty swallowing, dysphagia. Chest pain, not related to the heart. Since Barrett's esophagus increases the risk of esophageal cancer, it's essential to monitor the condition regularly. Diagnosis. The diagnosis of Barrett's esophagus typically involves endoscopy, a thin, flexible tube with a camera is inserted into the esophagus to visually examine the lining. In Barrett's esophagus, the tissue often appears red and velvety instead of pale and smooth. Biopsy. During endoscopy, small tissue samples are taken and examined under a microscope to confirm the presence of intestinal metaplasia. Dysplasia assessment. Pathologists classify the biopsy as no dysplasia, low-grade dysplasia, or high-grade dysplasia, depending on the severity of abnormal cell growth. High-grade dysplasia indicates a significant risk of progression to cancer. Treatment options. The treatment of Barrett's esophagus aims to manage GERD symptoms, prevent further damage, and reduce the risk of esophageal cancer. Treatment strategies may include lifestyle changes, dietary modifications, avoid trigger foods such as spicy, acidic, or fatty foods. Weight management, losing excess weight reduces abdominal pressure and reflux. Elevating the head while sleeping, prevents nighttime acid reflux. Quitting smoking and limiting alcohol, reduces the risk of further damage. Medications. Proton pump inhibitors, PPIs. These reduce stomach acid production, allowing the esophagus to heal. Examples include omeprazole and esomeprazole. Antacids, neutralize stomach acid for short-term relief. H2 receptor blockers, decrease acid production, though less effective than PPIs. Endoscopic procedures. Radiofrequency ablation, RFA, uses heat energy to destroy abnormal cells in the esophagus. Endoscopic resection, removes abnormal tissue during an endoscopy. Cryotherapy, freezes damaged cells using liquid nitrogen or carbon dioxide. Surgery. In severe cases or when dysplasia progresses to cancer, esophagectomy, removal of part of the esophagus, may be necessary. Monitoring and surveillance. Because Barrett's esophagus increases the risk of esophageal cancer, regular monitoring is essential. Endoscopies with biopsies are recommended based on the level of dysplasia. No dysplasia, endoscopy every 3 to 5 years. Low-grade dysplasia, endoscopy every 6 to 12 months, or treatment to remove abnormal cells. High-grade dysplasia, immediate treatment is often recommended to prevent cancer. Complications. The most significant concern with Barrett's esophagus is the increased risk of esophageal adenocarcinoma. However, not all patients with Barrett's progress to cancer. With proper treatment and regular monitoring, the risk can be minimized. Prevention. Preventing Barrett's esophagus involves reducing GERD symptoms and minimizing damage to the esophagus. This can be achieved through lifestyle changes, managing acid reflux with medications, and seeking timely medical attention for persistent GERD symptoms. Conclusion. Barrett's esophagus is a serious condition that requires careful management due to its potential to progress to esophageal cancer. While it cannot be entirely reversed, early diagnosis and proper treatment significantly reduce complications. Individuals with chronic GERD or risk factors should seek medical advice for timely evaluation and monitoring, ensuring better outcomes and improved quality of life.
Thank you for watching. Please subscribe our channel.